Hi everybody, my name is Matteo Prostorino and I'm an engineer belonging to super department of softwares of Media Lab Inc. I would like to welcome you and also to thank you for joining us to our webinar. My aim today is to show you our workflow from the beginning to the end. What I mean with beginning is that I will show you how to import a CT exam. And in the end, I will also show you how to design and build a proper surgical guide. My colleague, Engineer Maurizio Olivato, Vice President of Sales of MediaLab Inc., and Dr. Filippo Ivani, Vice President Marketing of MediaLab Inc., will answer to all of your questions. So at the end of this session, there will be a Q&A for you if you would like to ask us any kind of question relating to this presentation. So let's start with the software. Now, this is our software that I will show you. By pressing OK, the software will lead me to this screen where at the left side I reported all the patients and all the cases I uploaded previously, and all these buttons that will allow you to select to manage your data relating to patients. By pressing New and then Save, it's possible to create a new slot which I can use for import a CT exam. By pressing Import icon, we can select between two medical case import procedures. We choose manual one and we press OK. I know where data is stored. Maybe I can use a CD, maybe I can use a USB pen, but in this case, I have my own data which I want to upload on my desktop. So I choose my folder, I press once and then next. As you can see, the software accepts DICOM 3.0 files. And by pressing next, the software leads me to the following screen where I'm allowed to import my DICOM files. I suggest you to select DICOM sequence and select the sequence that you want to import. And then select the slice which you want to import. This case in particular is a mandible case, so I suggest you to import only the slice needed for mandible case. So for example, let's start with 90 and clicking next. This is the first file to import. And then by clicking another one in another time on, for example, 398 or something like that, you will see that there is the beginning of the mandible, so it's perfect for us to plan a proper case. Now let's go ahead. So by pressing import, you will see that the software performs some mathematical calculation in order to import every single slice I chose in the interval previously. Actual creation and all those mathematical calculation are thought for performing the import of the case as efficiently as possible. As you can see, the case has been imported correctly. At the right side of the screen, there is the preview of the CT I've just imported and the cross-section, of course. By pressing Open, the software leads me to the following screen. In the screen is reported the cone beam I've just imported. I can check by using the scroll mouse and a preview of the 3D model. Of course, I can make it better, but in this time, let's remain like this because the first thing I have to do in this case, it is a mandible case, is to trace mandibular canal. So first of all, in order to render available this screen, such as panoramic view, cross-section view, and preview of cross-section view, what I have to do is to trace panoramics. So let's press this button, because my aim is to create a panoramics useful for tracing mandibular canal. As you can see on the bottom part of the screen, there are some shapes you can use for tracing mandibular canal. But I suggest you to use the customized one, because I think, in my experience, is the best one to use. By pressing New and then clicking in a very easy way and fast way, following the path of mandibular canal, then going outside of the mandible, and of course, following the mandibular canal on the other side, and double clicking at the end, you will see that the software performs a perfect representation of mandibular canal on the right side. By pressing Create, again, the software performs mathematical calculation, because what I have to do right now is wait for the software to create all views, because all these views that software will create are needed for planning. So mathematical calculations are also needed to perform a good sight of everything I need for implant planning. Now, after having performed this panoramic view, you will see that the software shows everything you need. In this phase, we're not going to place any implants, but we're going to trace mandibular canals. So 3D and canals and trace canals. That's a particular feature of our software that allowed us to represent and to trace mandibular canal. By clicking once on Add First in Panoramic, I'm allowed to trace a central line following the path of the canal. By clicking 2 times, I command the software to end the tracing of mandibular canal. Again, on the other side, the same thing, same easy thing to trace mandibular canal. Double clicking at the end. Then I go up and come back to my trace panoramics. But this time, the panoramics I will trace will have to be useful for implant insertion. So I press 1 time New and trace mandibular panoramics in order to obtain a panoramic view useful for plant insertion. So if I press Create, again the software. This time, images are to be substituted. So the software creates once again the images, always very efficiently and very fastly, because what I have to do right now is place implants. So as you can see at the end of this waiting bar, the software will show us all the panoramic view and all the cross-section views, and of course the cone beam itself that will let us proceed with the implant planning. Of course, as you can see, this 3D model is a preview of the 3D models. It's a very raw model. To render it better, I can select Model, 3D Features, and then I can include what I like to render on these 2 rectangular windows. By pressing High Quality and then Apply and Exit, and raising, of course, the Hounsfield level at a particular kind of level. If I press Apply and Exit, the software will perform a perfect 3D reconstruction of the model. Now let's proceed with the implant planning. As you can see, it's really easy to place an implant in a very fast way. A new implant right here, right here, right here, and right here. And after performing this insertion, I can lower implant position in this manner in order to place implant whenever I want. Okay, so if I put implant like that, of course I can regulate myself with the cross section in this manner and also in this manner. Now, when I know that the implants are correctly positioned, what I can do is to upload an Stl file like this, implant list. As you can see, we have more than 100 implant manufacturers in our database because our system is an open system. So we can upload in our database any kind of implant manufacturer. We just need the Stl file of the implant itself, but we can upload any kind of implant manufacturer. From this list, we can select, for example, nails. And for example, I can choose 4.0 and 11 lamp implant. By pressing select, the software substitutes the default implant with the nails implant. And as you can see, the software remains on the same list. So it's really easy, really fast to change any kind of implant in our software. Okay, once I've been positioned the implant, next thing to do is to position the pin because I want to gain in stability on my surgical guide. So maybe I can position myself right here and then I can select from the list, previous list, ModelGuide, and then anchor pin. And I can place the anchor pin in a very easy way by selecting the position. And of course, also on the other side. Okay, so we position the pin on the other side and we also position the pin right here. Now we can go on with the design a surgical guide, but first we need to import the plaster model we will use to extrude the surgical guide. So to perform alignment, I need the 3 cubes of the universal stent. We got our patent for universal stent, and only MediaLab Inc. has the patent for that. It's only ours. So the next thing to do is to include the 3 cubes universal stent on my 2 rectangles, use a proper Hounsfield level, and then select Apply and Exit by selecting, of course, Removable Island. Okay, now, maybe the reconstruction is not quite good, so I can fix it by going one more time on the 3D model itself and selecting Very High Quality. If I select Very High Quality, you will see that the software will smooth more the 3 cubes and in order to render them better in 3 dimensions. Now I can perform alignment. So what I have to do is to go into plaster section, then alignment. On the right side, I need to import the fixed CT, so bone Stl file, that's what I have reconstructed before, import. On the right side, as I told you before, I need to import my universal stent. I know that my data is stored on demo case, then universal stent. By clicking open, you will see that universal stent is correctly imported. In this phase, only 3 points are needed to perform a good alignment. So we select 3 points right here, and 3 points right here. We press line, the software matches the surfaces I've just chosen, and then we perform registration at once. As you can see, also this time, we perform mathematical calculation, and as you can see, the matches is perfect. It's really perfect. The cubes are perfectly superimposed. By pressing exit, now we can import our plaster model for designing our surgical guides. So model list, import. We call it model or anything you want. We have to use registration. It's the procedure I've just did. I go in my folder when I know that the model is, and I press open. The color, we can choose the color different from that. For example, we choose green as a color. It's very visible. Now we press import. As you can see, alignment has been perfectly performed. The count follows perfectly the path of the model itself. Okay, now we're ready to perform and to design our surgical guide. Let's press guide and then prepare case for GuideDesign. That's our tool, our software for creating the surgical guide. We have three options to choose. CT and optical scan the model. It is this case. CT and prosthesis, double scanning protocol, and also bone supported surgical guide. In this case, of course, I am dealing with the optical scanner model. So I choose the first one and go ahead pressing next. I select the model I've just imported and select next one more time. So as you can see, this is the GuideDesign software for designing surgical guide. The first thing to do in this case is to close the model. Okay, so I press close model, surface, and close model. I choose surface because, as you can see, this model is really small. It's a really small model. So in order to obtain a proper model for design surgical guide, I must add some material underneath the model itself. After having performed the model closures, we can do our surgical guide in really a few seconds. So we select sleeves. For example, previously I chose the nails implants. So I choose nails guided drilling system, formulas for 2 as a 3D printer. Then as a preview, I can see that where support sleeves are positioned. Maybe we'll have also to add some support pin. So I choose lateral pin this way and lateral pin in this manner. Okay. Now we're able to trace our surgical guide. I can add some points right here in order to comprehend also the lateral pin. I'm rotating the model by pressing Ctrl and then by clicking the mouse on the model itself. In a very easy way, in a few seconds, I'm able to trace the line that will, by which there will be extruded the surgical guide. So, thickness, we choose 3.5, we recommend 3.5, and then we select Create Guide. So, as you can see, I didn't mention the first 3 buttons on the upper part of the model. Manufacturers are the guiding drilling system we own for making surgical guides. Also, in this case, we are in front of an open system, so it is possible to add and to perform any kind of guided drilling system. You can select, you can choose any kind of drilling system, but if you have your own guide drilling system, this software, with the GuideDesign software, you can add your mathematics to our software, and of course you can perform surgical guide with your guided drilling system. It's completely customizable. You can add any kind of guided drilling system. This software, of course, is really, really simple, and you can make a surgical guide, you can produce and design a surgical guide with few steps. First of all, making a design guide, and then afterwards you can export it in a really, really few moments. From left to right, the software shows you a every single passage needed to create a surgical guide. Okay, the surgical guide is over. I'm ready. I can export right now the surgical guide, because if I press export and then I press export once again, I choose the desktop for my commodity, and I choose save. What the software is right now, what the software is performing right now is the exporting procedure of the surgical guide. The surgical guide will be placed and be stored on the desktop, and I can take the Stl file on the desktop and put it and upload it on my 3D printer. It's over. Just a few seconds. But let me explain, if you want to add some features of surgical guide, you can add, for example, an inspectionals and fixing the dimension with this tool. Now the software is creating inspection, for example. You can add material, because if you want to give more firmness to surgical guides, you can add bridges around the support in this way, and then create. And also, if you would like to add some text, for example, the name of the patient, you can add it, raise it from the surgical guide itself. And of course, if there are some problems relating with adding bridges or anything like that, you can fix the former surgical guide with these two commands: fix support and fix guide fitting. Last thing I want to show you about our software is that you can create a model for analogs. So, for example, if you write these dimensions of the analogs on this command, then press D in order to copy all dimensions for all analogs, and then create model for analogs, what the software will do is that it will automatically build and create a model for analogs, a very precise model for analogs, as you can see from the STL of the implant. Now, my presentation is almost over. I can render invisible the model for analogs, and the surgical guide itself can be produced in this manner. So let's come out for the program. Now, we would like to thank you for joining us to our webinar. And if you have any further question about what I've just explained, you can write anytime, and my colleague Maurizio Olivato and Filippo Vanni would answer you to any kind of question. I report here also the contacts of me and my colleagues. And once again, thank you so much for joining us, and have a good day. Thank you.